My name is Dr. Qudsia. I'm one of the faculty members at California Career Institute. My background started back home. I finished medical school back home as a physician, and the life changed. We have to leave the country, and after I came to the United States, I was in a totally different, basically profession. It was always in back of my mind that I need to go back. So I came back to medical world and I started as a nurse, and then from there, I finished it at CCI. I was one of their former students. And then the CEO, Dr. Rafat or Ms. Manal, they saw a potential in me and they approached me to join the team. And it was something that I was always dreaming of, to be back in the medical world, teach students, change their future. So that's what I end up coming back to the medical world and teaching. I was a student once, so I can see their struggle. Each of these students, they have unique backgrounds. Each of them, they want to change their life. And I want to help them with that. I want to help them with that journey it literally changes a person's life once you become a nurse, once you have a profession that is helping others. So that is I love about it, to be with these students, to listen to them, to help them, to teach them, not just teaching them the ABC of nursing, also teaching them about how they can manage, how they can succeed in life. I listen to them. That is the basic thing, to listen to them, to listen to their struggles. Don't judge them, and don't put yourself in their place. That is the main thing. I'm here to show you what is right, what is wrong in this profession, how you can succeed. As I said earlier, you have to listen to them. Don't look at it, don't be judgmental, and put yourself. Empathy is the key in this, to have empathy with them. I say that to each student when they start, to don't take this as an easy ride. I love about those students, they listen and they follow this, and they are the one that they become successful at the end. And they mention it, that I remember that the first day you told us that you have to put aside everything else and focus on this to become a nurse. Everything is online that you could go and study, take a little bit classes here and there. There's so many like medical journals online available that you can study. And when we are in the clinical sites, like with the students, it's not just the students are learning. Sometimes I learn it myself with the students. So be open to that one. That helps as well. So as a nurse, you have to, same as we teach this in the classes, to have empathy with your patient. Put yourself in that place, do not judge, listen to them. That will be the main key once you become a nurse.
Is there a particular story that stands out of a student that inspired you through the years that you've
I have a lot of them. I had a student that, I'm not gonna say she or he, one of these students came from a very well-educated family and started to go to medical school at a young age and got involved in wrong pathway, involved with drugs, got involved with alcohol, become that bad alcoholic that lost everything. Even the family lost the family, that didn't know where the family is. And after years realized or start getting help and decided to become a nurse. And I was with them almost from the beginning. That student has all the attention to studying, of course, and was one of the brightest students in the class. till the day they finished it, passed the NCLEX the first try, like maybe a month after they finished the program here, and become a very successful LVN. But most of that at the end of the day, at the clinical site. At the end of the day, when we are back together and we have our post-conference talking about their patients or certain topics that we will talk, that is in the clinical. And the theory, the best time is when they have like quizzes and I see their results that they score really well. And especially when I see their journey from like at the beginning, that they don't do so well because they're not familiar with the program, and that makes them nervous. And I tell them to don't be nervous, you're gonna get better. And then like in the third and fourth quiz, when you see them that they improve and your results, that is very satisfying. Personally, I like cooking and baking. And besides that, I do painting sometimes too if I have time.
Oh wow, I didn't know that. You have to paint something for the office that we can...
If I have time, yes, absolutely. There's so many reasons for that. I think we have a very advanced curriculum. I have seen of course, the LVN, I'm very involved with it. I have seen the MAs. I'm not that much involved with the other programs, but I've seen these, and it is very, I could say, high quality curriculum. At the same time, it is the program by itself is very flexible. Like in the other schools, you will have 2 days for clinical, 2 8 days. But in our school, it is 1 day, 12 hours. It makes it for, especially these parents, that they give up their weekends. They cannot give up both days. But here, they only give up 1 day for 12 hours and they're done. So their flexibility is also good. And the staff is pretty good. I think we have the best staff. Study, pay attention. Don't take it easy. It's just that we will pass no matter what. That's not the case. We are here to help. We are here as we are teaching. We are here to help them as well. Do not hesitate to ask us if they need help with the studying, with any other type of guidance. So use us for all these